I'm Dr. Farah Ashraf, and I'm here at the University of British Columbia where I teach in the Faculty of Medicine with my research assistant, Dr. Raja Krandawa.
Hello. Today we are here to ask some questions to Dr. Shroff regarding her studies on holistic health practices in people with spinal cord injury. So, Dr. Shroff, tell us what is the significance of this study?
The significance of the study is based on the fact that we know very little about the population of people who live with spinal cord injuries, people who have quadriplegia and paraplegia, and what they actually do in terms of looking after their health besides going to their physician
Okay.
and their rehab professional. The study found that the vast majority of the people I interviewed did go to a massage therapist, a chiropractor, they did meditation, yoga.
Okay.
The vast majority of them were doing all kinds of other things to take care of their health.
Okay, that's very nice. So, can you tell us a little bit more about the study?
Sure, it was done here in the lower mainland of British Columbia, and the research question was, do people with spinal cord injuries access holistic practices, and if so, what types and why? It's part of my ongoing long-term research program on holistic practices, which has been something which has grown tremendously over the decades, where there's plenty more academic literature on this area now, and where we know that about 75% of Canadians are using holistic practices, and British Columbia is the main place where there's a big interest.
Okay. So, what were your findings in the study?
87% of the people I interviewed are already using some form of holistic
Okay.
practice. 2% weren't interested at all, and 11% wanted more information.
Okay. And why did patients choose to use holistic healthcare in adjunction to the regular care?
They found that the holistic practices brought them a great deal of relaxation, pain relief, stress release, and they felt an increased control over their health and well-being. The kinds of things they said to me were, massage and chiropractic, I have to use them. I can't live without them. People were really, really motivated
Okay.
to go.
What barriers did you come across while completing the study?
The barriers to people using holistic practices are significant.
Okay.
The first one is money. Holistic practices in Canada are unlike other care, which is paid for by the government. So paying for it is part of the barrier. Access, physically getting there. Not all buildings are ramped and made easy to get into. Transportation, another barrier, as well as time, because getting through the day through jobs and spending time with family, all of the other things that they have to do take up a lot of time too.
Yes, definitely. So, did you have any unexpected results while completing the study?
This was the biggest surprise for me when I asked them, so what else do you do to take care of your health? And our participants said to me that they smoked marijuana.
Okay.
And in all my decades of doing research on holistic practices, nobody ever has told me that they smoked marijuana. So I listened and listened, and in the paper I write about marijuana being quite common in the community of people with spinal cord injury, and the fact that it's Health Canada approved because of its evidence-based relief for pain and spasm. It's helpful for relaxation, and it really has made a pretty big difference in the lives of people with spinal cord injuries.
That's amazing.
So those are, in a nugget, that's the study. Thank you very much.
Thank you.